Have you ever brushed off a minor urinary issue, thinking it's just dehydration or stress? What if I told you that some of these tiny signs could be early warnings of something far more serious, like bladder cancer? Shocking, isn't it? The truth is, bladder cancer often whispers before it screams. And these whispers, these silent symptoms, are what we'll uncover today. I'm Dr. Sadia, and with over 10 years of experience in women's health and preventive care, I've seen firsthand how early detection can mean the difference between life and loss. Most of my viewers are women between the ages of 25 and 40. Many of you are mothers who tend to put your family's needs before your own. But today, I urge you to pause and reflect. Your health matters, and being informed could save your life. In this video, we'll explore 12 silent symptoms of bladder cancer. Subtle, often overlooked signs that deserve your attention. Let's begin with one of the earliest clues most people never take seriously. 1. Blood in urine, hematuria. It might be just a faint tint of pink in the toilet bowl or some rust-colored streaks, easily mistaken for menstrual spotting. But even the slightest trace of blood in your urine, especially when painless, could be an early sign of bladder cancer. Studies show that nearly 80% of bladder cancer patients report hematuria as their first symptom. Yet many ignore it or blame it on a urinary tract infection. The danger? By the time visible bleeding becomes consistent, the cancer may already be progressing. If you ever see blood, even once, don't wait. Get it checked. Now, while blood is a more obvious sign, many symptoms are much more subtle. And the next one hides in plain sight. 2. Frequent urination. We all run to the bathroom more often during pregnancy or after a long day of drinking water. But if you're finding yourself constantly needing to go, even without an increase in fluid intake, it could be a red flag. Bladder cancer can irritate the bladder lining, mimicking symptoms of an overactive bladder. The key difference? It doesn't go away. If you're waking up multiple times at night just to urinate, or feeling the urge minutes after relieving yourself, don't ignore it. And if frequent urination surprises you, what's next might shock you even more, because it's often misdiagnosed as stress. 3. Pelvic or lower back pain. Lower back pain is common in women, especially mothers lifting toddlers, groceries, and responsibilities every day. But when this discomfort becomes chronic, localized near the kidneys or pelvis, and doesn't respond to regular treatments, it could be linked to bladder or even kidney involvement in cancer. Bladder cancer, when it spreads, often affects nearby areas. Research from the National Cancer Institute shows that pelvic pain was reported in over 25% of patients at later stages. It's a sign that shouldn't be dismissed. Now let's move from what you feel physically to something even more internal, something your bladder struggles with silently. 4. Difficulty urinating or weak urine stream. Does your bladder feel full, but you struggle to start urinating? Or maybe your urine stream has slowed down noticeably over weeks. These are signs that something could be obstructing the flow. A tumor inside the bladder can partially block the urethra, making it harder to pass urine. Many women confuse this with pelvic floor dysfunction, especially postpartum. But if it persists, it needs medical attention urgently. What if I told you the next symptom has nothing to do with pain or discomfort, yet it could be your body's desperate call for help? 5. Fatigue without a clear reason. We all feel tired. But cancer-related fatigue is different. It's persistent, it's unexplained, and it doesn't go away after rest. If you're sleeping well, eating fine, but still feel utterly drained, your body might be diverting energy to fight off hidden cancer. Anemia, common in bladder cancer, can also cause this extreme fatigue. So when your energy suddenly dips without reason, it's time to listen. And while fatigue can be dismissed, what happens when your body physically starts to lose its strength? 6. Unexplained weight loss. Weight loss might sound like a blessing after childbirth or during a fitness journey. But losing weight without trying, especially alongside other urinary symptoms, can be a major red flag. Cancer changes your metabolism, and your body may start breaking down muscle and fat even when you're eating normally. If you lose more than 10 pounds in a short span without any change in lifestyle, it's time for a deeper evaluation. Next, let's talk about a symptom that most women blame on hormonal shifts or stress, but could be far more sinister. 7. Night sweats. Dripping with sweat at night even when the room is cool? That's not normal. While night sweats are often associated with menopause, They can also be linked to systemic illnesses, including bladder cancer. The body tries to regulate itself against the tumor's inflammatory response. So if you're consistently waking up soaked, especially with no fever or infection, don't ignore it. Sweating at night may be disturbing, but what happens when you actually start feeling sick? 8. Recurring urinary tract infections, UTIs. Frequent UTIs may feel familiar to many women, especially during pregnancy or after intimacy. But if they keep coming back despite treatment, it might not be a simple infection. Bladder tumors can mimic or cause similar inflammation. A study in the British Journal of Cancer found that 13% of bladder cancer patients were misdiagnosed with UTIs in early stages. So if your UTI symptoms aren't resolving as expected, insist on further tests, possibly even a cystoscopy. Let's now explore a symptom that affects your body's immunity and might seem completely unrelated to the bladder. 9. Swollen legs or feet. Swelling in your lower limbs, especially if only on one side, could indicate a blocked lymph node or blood vessel. When bladder cancer spreads to the lymphatic system, fluid can accumulate in the legs. Most mothers write it off as a circulation issue or being on their feet all day. But persistent, uneven swelling warrants immediate attention. Now from swelling to something even more unsettling: how your appetite changes without warning. 10. Loss of appetite. Are you suddenly uninterested in food, skipping meals, or feeling full quickly? This can be a systemic sign of cancer. As tumors grow, they release substances that interfere with digestion and appetite. This, paired with fatigue and weight loss, forms a trio of concern. Never ignore when your body resists nourishment. We're down to our final 2, and they might be the most surprising of all. 11. Burning sensation while urinating. We often associate burning with infections, but when tests keep coming back negative and the sensation lingers, consider deeper causes. Bladder cancer irritates the lining of the urinary tract, causing discomfort. If you're experiencing this without other classic signs of UTI, or if antibiotics aren't helping, it's a signal to dig deeper. 12. Incontinence or leaking urine. While postpartum women often experience some degree of incontinence, bladder cancer can worsen this symptom or present it anew. Tumors can interfere with normal bladder function, causing sudden leaks or urgency. If your leakage isn't improving or has begun unexpectedly, this may not be just age or childbirth catching up to you. These 12 silent symptoms may not all seem alarming at first, but your body whispers before it shouts. As women, especially mothers, we are often taught to endure, to push through discomfort, to prioritize others. But today, I urge you, listen to your body. If even one of these signs feels familiar, don't delay. Early diagnosis can save lives. Share this video with someone you care about. It might just help them recognize a sign they've been ignoring. And don't forget to subscribe for more health-centered content that empowers women like you to live informed, fearless, and fulfilled.